Hello and welcome to another Coffee with Carriers. I'm excited to be joined today with our business partners and friends from Blue Cross Blue Shield of Arizona and Prosano Health. So welcome to Coffee with Carriers, Kathryn, Mallory, and Dr. Carhartt. Thank you for joining me today. So before we jump into our conversation today, could you just do a quick introduction of yourself, Kathryn, what your role is, what your team's responsible for, and also what is one of your favorite activities in Arizona?
Well, first of all, thanks for having us here today, Jack. I'm Kathryn Mattson. I'm the staff vice president for the small group sales team. So my team, we work with small employers in that 2 to 50 market segment. We're responsible for both sales and service. So some of my favorite things to do in Arizona is definitely, I'm an avid tennis player. I try to play at least 3 or 4 times a week.
Love it, love it. So I'm gonna ask the same question of you, Mallory. Can you tell us a little bit about yourself, your role, how long you've been in the industry, what your team's responsible for, and of course, what do you like to do in Arizona?
You bet. Well, I wish I was a tennis player, and I do dabble in pickleball. I am the Chief Operating Officer of Prosano. I've been in the healthcare delivery business for 25 years now. It's hard to believe. I help with the strategy and with overseeing the operations and partnering with such great people like Kathryn and Dr. Carhartt to bring this to life for Arizona. What do I like to do? I like to go to great restaurants. I like to hike. My claim to fame is I have triplet boys who have a birthday this week, so that's really what gets me up every day. But yeah, we're doing some great things here, so it's going to be fun to talk to you this morning about them.
Triplets, congratulations. How about you, Dr. Carhartt? Tell us a little bit about yourself.
Yeah, absolutely. Again, thank you so much for having us. My name is Wylie Carhartt. I'm the Executive Medical Director for Prosano Health. I'm a practicing primary care physician. My role is really about making sure that the team members that we have are able to do the best work that they can do, and I help support that as best as I can. In terms of things I like to do in Arizona, I love to spend time outside with my family. It's just really a beautiful area to live in, and so blessed to be here.
Thank you so much. I really appreciate all of you being here today. I'm really excited for this conversation because Blue Cross Blue Shield of Arizona, along with Prosano Health, is doing something very unique in the Arizona market. As we have the conversation today, I'll get into my experience having an opportunity to go through the Prosano Health model. But before we do that, can one of you talk a little bit at a high level, what is Prosano Health?
Prosano is really a personal, affordable, convenient healthcare experience for our members. It's bringing the best of healthcare delivery with the best in healthcare administration. It's a very unique model to the state of Arizona, and we're super excited to offer it to all of our commercial lines of business beginning in January of 2024.
Very exciting. How about you? How would you describe it?
To me, it's magical. It's game-changing in healthcare delivery. So the vision for Blue Cross is to provide health solutions for the entire state. We are starting in Maricopa because that's the largest density of our members. However, our ambition is to be serving the entire state. And so Prosano Health Solutions started with Prosano Health Advanced Primary Care, and Dr. Carhartt and I get the opportunity and honor really to lead that because we are doing something special. So it really flips the script on healthcare in America, and as Kathryn said, it kind of doubles down on delivering on an experience. What we know is if members feel very comfortable with their primary care team, if their primary care team also feels like they can operate at the top of their license, so to speak, and truly provide the care that they know how to give, they can truly quarterback most care and create a better experience for the consumer and for the employers and everybody that's really in the community.
Perfect. And Dr. Carhartt, I'm going to come back to you a minute because we've heard a couple phrases, and a lot of that's been around member experience, patient experience. But before we come to that, Kathryn, very unique strategy, right? Moving into the care portion of the delivery model for Blue Cross Blue Shield of Arizona. Where did that come from? Like, what was, the genesis of that mission or opportunity in the market?
I think when our leadership came to Arizona, they took some time and did a ton of research. So the Prosano model is actually rooted in quantitative and qualitative research. So what they were finding is that when people were responding to the survey, there were several things in that survey that Blue Cross just couldn't affect. So some of the things that came back were People wanted to spend more time with their provider. A lot of times people go in, they feel like they're in and out and they're rushed. They wanted their time to be respected. So if they have an appointment that's set at 2 o'clock, they want to be able to see their physician at 2 o'clock. After evaluating the research, like Blue Cross Blue Shield of Arizona said, all right, well, many of these things we cannot influence. We cannot control how long a provider spends with their patients. We can't control when a patient gets to go back and see the provider, hence the birth of Prosano. And this is Blue Cross Blue Shield of Arizona's first time entering into healthcare delivery. We're super excited about it. We encourage all of our brokers and business partners, if they're interested into really learning about the model, they should come for a visit.
Yeah, and I had an opportunity to go on one of those visits, and you're right, it's very unique and a very special delivery model. And I think I heard during that visit, signature experience. Dr. Carhartt, you want to talk a little bit about that signature experience?
Yeah, absolutely. One of the beauties of starting something from scratch is that you get to build it the way that you think it should go. We have really focused on making sure that that member experience and frankly our team's experience meets the moment. And so we have something called the signature experience. It focuses on 6 experience standards that really get into making sure that we can deliver on what Kathryn was saying, the affordability, the personalization. We try to remove the friction from the member and make it less complex for them, make primary care what we call advanced, right? So by doing so, we're making sure that we're shifting the focus from away from volume and more towards quality. And so quality includes not just the care that you receive and your outcomes, but just how you feel too. When you come into a primary care office, oftentimes the primary care facilities can be a little bit disjointed. You don't really get a lot of time with your clinicians, and this experience is really intended to make sure that we have the time so we can build trust with our patients so that we can get better outcomes.
From my own personal experience on going on the tour, that really starts the minute you walk through the door. It was probably one of the nicest waiting rooms I was ever in, but I think there was intention behind that experience when you walk in. Would one of you be willing to talk why there was so much emphasis on that initial experience when you walk through the door?
Absolutely, it's very intentional. One of the things that we really want folks to understand is this payer-provider integration and the power of that. So when you walk into the waiting room, you don't need to give your insurance card. This model, by the way, is exclusive to Blue Cross members. So if you are part of another health plan, our front desk doesn't have to worry about that. They're just focused on Blue Cross members. And so that exclusivity is important, and it enables us to deliver that level of service. I always say most healthcare offices would love to provide this level of service, but they can't because, like Dr. Carhartt said, by design, it's not designed to do that. So when you come in, no membership ID card because we have it. Blue Cross has sent that to us, so we do have access to that. Everything else in the waiting room, from the digital, kind of education board to kind of the minimalistic seating, kind of the refreshment bar, all intends to deliver what Dr. Carhartt said, which is build trust from the minute you walk in and make you feel comfortable so that by the time you get back to meet with him, that you feel relaxed and comfortable, and you can really have a good, meaningful exchange about your health, which is, again, not the normal experience.
Well, and I just want you to know that the snack bar didn't go unnoticed on my tour. So it's a very, very nice touch. Dr. Carhartt, as much as I enjoyed the snacks, that's not where the magic ended in the experience, right? When you walk through the door and you're on your way to the examining room, that's really where I saw the impact of the experience being very unique and special. Can you kind of pick up from when a patient, one of the Prosano members, heads through that door into the waiting room and what that experience will look like for them?
Yeah, I think you nailed it. As beautiful as the facility is, it really is about our people and the time that we get to spend with people. So when our patients, get escorted into their exam room, that's their spot for, the next 30 minutes to an hour, and we really get an opportunity to sit down, talk with them, really get to the core of what's going to help with their health journey, how they can proceed and feel that they can trust their clinician and their primary care provider, because it needs to be built on trust. If we don't have the buy-in from our patients and the opportunity to really impact them, then we can't get to the goals that we have, and including making sure that the member gets a great experience, making sure that we can keep primary care activities within primary care and not shifting those services over to specialists, and really reducing the total cost of care for our members.
And one of the things that I found interesting was the examining room was very, very different than any examining room I'd ever been in. I just thought the technology was unique, the ability to access medical records and information. And also, I know, not to be petty, but there was a pretty unique chair in there.
Our members really do love that exam chair, rather than being at a big, bulky exam table where you're 3 feet up above the clinician's chair and you're right at eye level. And we really enjoy the fact that it's not just about doing the exam and being at that table. We also have a consultation space. So our members get an opportunity to sit with us eye to eye, and we really get into various aspects of their life. We talk about sleep, we talk about nutrition, we talk about exercise, we talk about stress management. And we all know, as employees, right, stress is rampant. And so it's really important for us to be able to hit on that and make sure that we have the time to talk about it. In addition, we have behavioral health on site, which is so critical. I know a lot of primary care offices are starting to bring that in-house. It's important to make sure that we're taking care of the whole person, so both their emotional health and their physical health.
Yeah, I think that whole person and whole health perspective was very unique. And the fact that you get to sit down at a table and have a conversation. One of the other unique things was scheduling. I know even my own personal experience, your doctor definitely wants to spend time with you, but they've also have other patients. But I thought the way that you manage your scheduling was very unique, that allows you to spend an additional amount of time with each member to dig into those other topics. Can you just talk a little bit about that? And then I'm going to come to you, Lori, because obviously a lot of what we're seeing in that visit was by design. It was a lot of pre-thought work before we ever got to building out the offices. And so I want to talk to you a little bit about that as well. But can you talk about your scheduling and just the time that you're able to spend with each patient?
Because we've been able to shift away from volume to quality, we've liberated physicians and given them the opportunity to take care of patients with the time that they deserve and the time that they need. We know that when we invest more in primary care, we get better outcomes. And we know that that time is what's so crucial there. You can't make that up. You can't fabricate it. It needs to be there in order to make sure that patients have an opportunity to talk about what's really at the root of what's going on with their health.
Perfect.
Yeah, and I was just going to add that another unique feature about the Prosano Health centers is that they have care guides right on site. So it's customer service that's built in on site. If they have a Prosano member that needs to go and see a specialist, those care guides are there to help that patient navigate a very complex system. So they will schedule the appointment with the cardiologist. They will make sure you're going in for your visit, and they're going to take a vested interest in making sure you get the care at the right time, at the right place.
And you're right, I thought, again, the environment and the direct connectivity to Blue Cross Blue Shield of Arizona, if there was ever a question about benefits or a referral, the speed and the availability that's built in is unique in itself.
Yeah.
Talk a little bit about that as well. There's direct contacts from Prosano to Blue Cross Blue Shield of Arizona as well.
Yes. So as you know, Blue Cross Blue Shield of Arizona, as an employer, we were the beta group for Prosano Health. I have employees that are on a Blue Signature plan, and they rave about their experience. They can go in and talk to a care guide. They can go in and talk to their providers 24/7 through a patient portal. There's after hours availability with the physicians. And to your point, we have benefit liaisons also in each of the clinics. These individuals are responsible for helping members understand not just their health benefits, but all of their benefits. So the benefits that Blue Cross Blue Shield of Arizona offers to employees, like we have lifestyle accounts that we can use. So if you, like me, love to play tennis, Blue Cross will help pay for those lessons, and they'll help pay for equipment through our lifestyle account. And the benefit liaison actually shares that information with members so they get the full picture of everything that they have access to support them in their health journey.
Very unique experience. And One, just as someone who's a participant in this industry, but also a consumer of health, I could see myself in that model as well. So I was very impressed. So Lori, I'm going to come to you. So Chief Operating Officer for a big undertaking like this. I know you had mentioned early on that the focus was in Maricopa County. What are the expansion plans in the near future and as you look out like 3 to 5 years from now?
Everything's intentional, right? Most of us have been doing this for a long time. That is the beauty of our team, is we have so many years of experience, and as Kathryn started with, a lot of research from not just consumers that live in Arizona, but from a lot of the providers that told us what it's going to take to really run a model, because that's one of the reasons I joined the team, is because they actually spent the time also finding out how do the providers feel, because as you guys know, there's a primary care shortage in the country. So people say, how are you even going to do this? Well, it's because we put so much attention, having Dr. Carhartt and his peers across the country help us figure out what they want to do. Why did they go to medical school? The research is important to where we're going, right? So to answer your question, we're going to go where the consumer needs us, and we're Kathryn and her team and the employers across the state. But we do have ambitions to serve our Medicare and eventually Medicaid and the open marketplace members across the state as well. And so we're going to let the business kind of drive the locations. We know Maricopa, obviously, very robust need. We plan to be in Tucson. We already know that for January of 2025. You have to start, I think we're actually working on 2026, and if you're doing what you guys do every day, I'm sure you are also sometimes talking about that far out. We are going to go to Tucson, and then we're going to hit the rural market areas. And what I will tell you is we don't want to be a Starbucks or a Walgreens or a CVS. We have no ambition to be on every street corner. This is unique to Blue Cross and Blue Shield. We don't have ambitions to take other plans, other carriers to dilute the model. A part of the model that we haven't talked about yet this morning is it's a $0 access for both the behavioral health and all services in the primary care, including your laboratory. And that's very powerful. And so we have to be very careful about our expansion and how we grow. And so we want to meet the needs of the employers first, figure out what that looks like, and then add the other lines of business. I expect you will see some version of Prosano or a Prosano Health solution all throughout the state sometime within the next 5 to 10 years.
So obviously very exciting, rapid delivery to the system, a lot of growth. As a Chief Operating Officer, what do you think is one of the largest obstacles you'll have to overcome for success?
You can try to say, well, it's a little bit Kaiser-like, but as we talked about before, it's on a PPO chassis. It's not an HMO. It's not a controlled model. It's not intended to be that way. So we have to be very careful. But I think the biggest obstacle is making sure people really understand what it is, and then engaging, right? If you picked a Blue Signature product that's on a PPO, you don't have to go to Prosano Health Advanced Primary Care. If you do, it's going to be a $0 access, and you're going to have an experience that blows you away. And sometimes people think, I can't leave my doctor, I don't want to leave my doctor, but then they get to thinking about it and they're thinking, well, I just got my bill, it went straight to my deductible, and that was $200, and then, oh, by the way, I also had to pay for this and that and another thing, and oh, by the way, they only spent 7 minutes with me. Being able to tell the story and figuring out ways we can get consumers to understand the differentiation, I think that's the biggest challenge right now.
Yeah, and I think that's a unique opportunity as well. So Kathryn, I have a question for you. As a Staff Vice President of Sales, right, you're obviously focused, and so is your team, on delivering Prosano to the market as a viable option for employer groups in Arizona. So if you were to speak to brokers, and I'm sure you have, how would you have them describe Prosano to employers and to their employees?
Prosano is a very unique model, and it's going to be a unique experience for the employees that enroll in Prosano. As Lori mentioned earlier, when someone goes into a Prosano Health Center, all of their services is covered at no cost share. So they're getting preventative assistance, sick care, chronic disease management. They have that support that they need to help individuals navigate the healthcare system. So if I'm talking to the broker, a couple things that they're going to want to know for 2024. One is on all the Blue Cross Blue Shield of Arizona commercial proposals, they're going to see an indicator on their bid documents as well as on their renewal documents that will tell them how many employees within that group live within a 20-mile radius of one of our facilities. So if you see 100%, then I think Prosano is a really good fit for that employer. As Lori mentioned earlier, this is a PPO. So they have in and out of network benefits, and they should think about it as kind of like a tiered network. So if you go into the Prosano Health facility, it's no cost share. But if they want to use a statewide PPO provider, they can. And they're also protected by our Blue Card national network as well. I love that about Prosano, because here in the state of Arizona, we are a PPO state. And Prosano just gives employers and employee an affordable option. I love this for small group, because a lot of the businesses that we work with in that 2 to 50 space, employees may not be making six figures. And so now they know that they can access quality health care at no cost for them or their families. And so it's a win-win. It's a win for the employers, because these plans are actually slightly discounted from our statewide PPO. It's a win for the employees, because it's going to help them save money in the long run as well. If you can't tell, I'm super excited
There's
about
a
Prosano.
little bit of excitement
Yeah.
there, Kathryn, which I appreciate. I mean, at a very high level, I mean, what I'm hearing is lower costs from contribution perspective, so payroll deductions, lower expenses at point of service, and then a very intimate, detailed experience when you're accessing care, which really at the end of the day is probably the most important thing. So Dr. Carhartt, I know you've had an opportunity to work in other models in your career. How would you compare this experience at Prosano Health to what your original mission of practicing medicine was?
Yeah, absolutely. I think that's a great question. When I graduated from residency, I decided I wanted to lay roots here in Arizona. I love it, and I wouldn't second guess it for the world. I moved into community health space, and I really wanted to help treat the underserved, and I got to do that, and I was blessed and fortunate to do so. But the reality is that in a fee-for-service model, right, it's all about volume, and so you end up seeing more and more patients, and your time keeps getting stripped away more and more. I was really looking for something that was different. I was looking for something where I could, use my license, be able to really take care of people to the best of my ability and give them the time that they deserve. So that was why I was so thrilled to kind of join this venture, because it's definitely been something where we're not having trouble recruiting, I'd say.
Yeah.
Our physicians and our nurses, the rest of our care team just really love this model of care. It really makes them feel well-rooted in what they're doing, makes them feel as if the passion and the reasoning behind going into medicine is there, and you don't see that very often, especially in primary care.
Going through the tour and having some time with you on a personal level, I know it was a very strong mission of yours to be focused on the patient, spending time, using your passion and skills to improve the lives of your patients. And I know one of the things that you noted is this allows you to practice medicine in the way that you intended. And I'm just really excited about that. And I'm sure the members that have had the experience at Prosano can really feel that from you. And at the end of the day, I feel what we do, that's the most important thing, right? Dr. Carhartt, one of the things that I heard you mention during my tour was working at the top of your license. Can you explain to me what that means and how that impacts your patients?
Yeah, absolutely. Even more broadly than just our physicians, right? Our whole care team gets to do that. They get to work at the best of their ability at the top of their license. And so what that means to me is being able to do primary care in a way that's not just focused on volume and bringing patients to specialists and kind of being a model where we can operate like true primary care physicians. We can take care of patients in a way that 80 to 90% of the care that they receive can be done in the primary care center. We want to be confident generalists. The only way we can do that, again, is with time and the opportunity to have a chance to connect with patients.
What you just said, Dr. Carhartt, I thought was great. And one of the ways I see, so I'm not a clinician, right? So I'm on the leadership side. We had a patient the other day, brings in her like 12 or 13-year-old son. He had a rash or something on his arm that was really bothering him. And so they were going to go to a specialist. But the physician was able to say, hey, let me take a look at that. And because we have some unique partnerships that we've designed, they were able to take a picture of it. And the physician was able to send it to our partner. A dermatologist got on, looked at it, and was able to give some really good advice for the doctor to give to the patient. We saved a copay. We saved the hassle for that family, so we were delivering on affordability, convenience, and personalization, meeting that patient where they're at. The kid had some anxiety about it, so met them where they were at, all because we've enabled the doctor to work at the top of their license and to say, hey, and then bring in somebody if they needed to for just a little bit more of a reassurance to make sure. Now, do we pay for that? Absolutely, we pay for that. We paid that specialist for that, but that is a part of the uniqueness of our model. We bring it in, and if Dr. Carhartt and his team feel like, hey, I want to do it all on my own, or if I want to bring in an infectious disease person or a dermatologist or whatever, I can do that in the exam room. And that's not for everything, it's for the appropriate visits, but it's an example, I think, where they are able to create a different experience that you normally can have.
And I think it's a very powerful example, right, of how you're revolutionizing primary care, right? But to add on to that, I know one of the things that I noticed that there was other diagnostic resources available to you in the facility.
Yeah, I would say because we have had an opportunity to really think, what can be done within primary care that normally would be referred out to specialty, we've really started to lean in on what's within our scope. So to that end, there's a lot of new things that we're able to kind of bring back to primary care that we've traditionally just offloaded to specialists. So that includes joint injections, that includes simple procedures like placing IUDs, removing IUDs. These are things that nowadays a lot of employees, patients don't even realize that primary care can do. So we're trying to re-educate people, let them know that all this can be done and at no cost.
Can you talk a little bit about the tools, resources, and other ways that you support your patients outside of their physical visits to the office?
Yeah, absolutely. The fact that we do virtual visits, so everything that can be done within the care center, we are trying to do that as well in a virtual environment. So patients can come in and do virtual visits as they need to, from the comfort of their home, from the comfort of their workplace. So that's a big satisfier for our patients. Outside of the day-to-day taking care of patients, we really are focused on engaging that population, the planned population. We are monitoring if patients are going into the emergency department, and we're doing follow-ups. Our nurses and our clinicians are doing those personalized outreaches to those patients, making sure that they get timely follow-up, making sure that they have everything that they need if they got discharged and medications were supposed to be sent over, and making sure that those actually did get sent over. If they didn't, we'll refill them. Our care is really focused on not just what's happening within the care center day to day, but it's focused on being proactive and engaging our members and making sure that we're meeting members where they're at.
I think that's so uniquely important. And I think one of the challenges that we have in our delivery model is that overall support of members and patients, right? And I think that Prosano Health does a really good job of that. So Lori, a lot of forethought, planning, very specific missions that you were targeting when you designed Prosano Health. Can you talk about some of the other missions or focuses that we haven't discussed today?
I would love to, and I get so excited about this, so it's hard to know where to start. But I think we have a care model wheel that you may see if you ever see a presentation, and Dr. Carhartt already did a nice job of talking about the value-based care and the focus on quality. Well, one of the other core foundations to that is that we are focused on health equity. And sometimes that word gets confusing to people, but it's kind of best with an illustration that most providers, when they join healthcare, they hope to treat everybody the same, right? That's what they hope to do. They did not decide one day, I'm going to treat a different population differently. They want everybody to be treated the same, but the models aren't the same depending on your zip code, your location. Dr. Carhartt just gave a great example. We'll meet you where you are. We'll talk to you virtually. And so that health equity piece is we have the opportunity to design it from the ground up. So we have the opportunity to offer similar services, extended visits, virtual care, behavioral health. We've really normalized that so that people don't feel like you have to go sit on a couch with a box of tissues and just cry about everything. Like, it may just be like, I'm struggling with managing my elderly parents and my kids at the same time. Or, you know what, this is a sales season and it's really tough and I'm a little stressed. I'm not being a very good partner at home. And I just like to talk to somebody about that besides somebody in my own household. And I'd like to do that, by the way, on the way to work. And so some of those things are really ground level health equity, right? Like, how do you meet somebody where they are? If you're a single mom that's dropping 3 children off at school, 3 different schools, on the way to work, you may not have that opportunity to have a meaningful conversation with a physician, but now you can in a trusted environment in an extended amount of time, meeting you where you're at. So that intentional design helps us provide health equity across the state, and that's just going to go deeper and deeper. So I just gave you a very general example with the virtual, but there are so many others, and I think it's important for people to understand this is much bigger than any of us. Right, we have a bigger responsibility here for the state of Arizona and for healthcare, and that's pretty much why Blue Cross is the amazing organization that it is, because they've been committed here for over 80 years with this new model and focus. No doubt they'll be here for another 80 plus years. Anything we can do to help make a better, healthier community for everybody, that's what we're trying to do. So that health equity piece is super important.
Yeah, and I think it's such an important movement to really focus in on those underserved portions of our community, right? And that's one of the things that really struck me in the conversation is that really has gone into your physical location planning, the way in which you're positioning it in the market. I think it goes all the way to your copay or lack of copay strategy, right? It's really getting those individuals that might not necessarily access care because of a cost component or not having availability to a facility. And I think that's one of the major principles that it's going to change the Arizona landscape. So great work on that. So we've talked a lot about Prosano, and just the level of excitement and energy from the three of you is amazing. And I really do believe, and I'm very excited to be going on this journey with you. But I think a big question, Kathryn, that we need to answer is how do Arizona employers and their employees get access to Prosano Health?
That's a great question. So a couple of things to note. In order to access one of the Prosano Health facilities, the employee has to be enrolled in a Blue Signature Prosano PPO. So during the employer's open enrollment this year, you're going to see at the very top of the bid documents and the renewal documents all of our Prosano options. So for the 2 to 50 market, we're going to be offering 2 gold plans and 2 silvers. The deductibles start at $1,000 and they can go up to $6,500. The out-of-pockets will start at $6,000, goes up to $8,500. Most plans are going to be an 80-20 co-insurance. The unique thing about these plan designs is that when the employee goes into the Prosano Health facility, it's going to be no cost. But if they decide to use one of our PPO network providers, that member is going to be subject to deductible and co-insurance for those services, unless it's preventative. Copays are only available on the prescription drug benefit. So no cost for the Prosano Health facilities. It's going to be subject to deductible and co-insurance outside of Prosano, within our PPO network, and then copays for prescription drugs. So it's a 4-tier copay benefit.
And I know that I should know the answer to this, Kathryn, but you had mentioned earlier in the conversation when you're putting your renewals and proposals together, there will be a notation of the percent or number of employees that are within the service area. For those employers that see that information and say 30% of their employees are in a service facility that could access Prosano Health, can they still have Prosano Health and offer something next to it for the other employees?
Yes, absolutely dual option. So they can put a Blue Signature Prosano PPO in place alongside a portfolio high deductible health plan that can be paired with an HSA, or they can put in an Everyday Health. So really, our employers can offer up to 4 plans unless they have 10 or more enrolling, and then you can offer 7 plans.
Okay.
I would definitely recommend dual option, giving employees a choice whether they want the traditional copay plan or do they want to give Prosano a try.
Well, it sounds like they can get both, the best of both worlds there, so the flexibility is appreciated. Thank you so much for being here today, Kathryn, Lori, Dr. Carhartt. Great information. And very exciting for me, and I'm sure for all of you, to be part of something new, something that's cutting edge, right? Something that's really focused on changing the experience for the people that we support in Arizona and we all live next to. Congratulations to all of you. I'm excited to go on the journey, as I said, and to help more Arizonians find out about Prosano Health. So thank you for being here today. I appreciate it.
Well, thank you.
Thank you very much for having us.
I look forward to seeing you all again on a future episode of Coffee with Carriers.